This is one of the most important sections that is required for oxygen conservation today in this country. And this section is all about the oxygen weaning protocol. Now, I'm not a medico, but obviously when we work into the oxygen audits, we understand all of this. And I'm going to try to put it in a layman's language so every doctor, every nurse, every paramedical staff and every biomedical engineer understands this most important section, that is the oxygen weaning protocol. Now, what does this oxygen weaning protocol say? Each state, each country has its own standard, but by and large, what we follow here is the patient, if he is maintaining at 92% SpO2, is good. Now, yes, there is a SpO2 and there is a FiO2, and then there is the PO2 and there is the automatic biogas analyzer. So, I am not going to do too much of complexities. For the common person to understand, we will refer it as SpO2. While I am sure my medical friends would understand the differences in all of them and at the right point know which kind of O2 level to check. So SpO2, first of the most important step which are missed by the most of the hospitals in India is using an oximeter which also has SpO2. It is having a respiratory rate mechanism, to check RR, respiratory rate, and a mechanism to check the pulse. Now, what we should understand over here is that if you use a very cheap oximeter, there are a lot of fluctuations, and in the long run it could be very costly for you, and it can make a lot of difference to the patient also. Thus, use a very good quality of oximeter is the fundamental foundation on which the oxygen weaning protocol is based. Correct measurement of oxygen levels, I would say. So beyond the measurements for the patients on the ventilators, in the ICUs, there has to be periodic checking of ABG being done, and this is important to establish their PO2 levels, to establish at what level the oxygen delivery mechanism has to be set to the patient. Now let us look what is it here. So we all have known and heard that there is a hypoxia, there is lack of oxygen, and there is the hyperoxia. There is a lot of oxygen given to patient can do permanent damage to his lungs, to his eyes and other organs. It's an essential drug. It's dangerous to give too much of oxygen. So we have to give the oxygen at the right LPM, that is the liter per minute, and this is the essential adjustment which can be done on the flow meter that is available at the oxygen points. Most of the flow meters in the normal oxygen beds support from 0 to 15 liter per minute of delivery, and the patient in the triage area, you should establish at what level of delivery is optimum for this patient to maintain his SpO2 levels above 92% constantly, and not allow them to fall below 92%, but not above 94%. This is a good range so that the patient doesn't have hyperoxia. And you try to maintain and stabilize the patient here and set the LPM, increase or decrease as per the demand. Every 2 hours, measure, chart out, check, shall I decrease the oxygen, shall I increase the oxygen, and keep the patient in this range. This is the simplest way you can achieve and save around 30% of your oxygen. Of course, there are more complex things in the ventilator settings, like increasing the PIP, reducing your oxygen delivery mechanism, reducing the LPM flow of the ventilator. Now, there are a lot of clinical things which get involved. So I don't want to set it as a parameters. It is the discretion of the treating physician, treating doctor on what call he has to take. But yes, there are points where you can really increase the PIP, reduce the LPM, and have the same effect on the patient. I would really love that my friends in the medical field will surely come out with a detailed video on this section, and I appeal to them for the so. But now in this section, we will deal with increasing PIP, decreasing the LPM, setting optimum FiO2, if there is no improvement by significantly pumping the oxygen, then you should stabilize the patient by stepping down a little and checking. That way you know that the patient is not going bad and is not improving, and long term may require to be on the ventilator. So this way, if you establish proper oxygen weaning protocol and monitor continuously, and in the next part B, we are going to look at many more techniques how to have this oxygen weaning protocol established and run properly into the hospitals. Thank you.